Welcome back, folks. My name is Joe Bloodgood. I'm here with my partner, Nathan Faith. Today, we're going to talk a little bit about Medicare. Last time we spoke, we dove into those gap years between company provided healthcare and Medicare. For a lot of people, those are the years between your late 50s or your early 60s and age 65 when we're sort of out on our own and we're looking to put together a plan as a stopgap. Today, we want to look a little bit closer at Medicare and some of the phases within that from a tax standpoint and look at how your income can affect that. Nathan, share with us a little bit on income and the cost of Medicare and some things that we should be thinking about.
Thanks, Joe. As many of you know, Medicare is health insurance coverage provided by the government that starts at age 65. The coverage that's provided by the government are parts A, B, and D, which cover your stays at hospitals, your care by physicians, and of course, your prescription drug medication. Many years ago, back in the mid-80s, Medicare cost the same for everyone. However, in the mid-80s, Medicare ran into some financial trouble, and in order to shore up the finances, Congress decided that as one's income increased in retirement, that they'd be on the hook to pay more and more for the same health insurance coverage. So when you think about it, paying more for the same insurance is really just an additional tax. So how much does Medicare cost us each year? This is a view of an illustration that breaks down the cost and when we specifically have to pay more based off our income from our tax returns from 2 years prior. So what you'll notice is the threshold to pay the minimum amount into Medicare for a married couple is fairly high, $180,000 a year. And below that threshold, our cost for Medicare for a married couple is $4,000 a year, approximately, or about $2,000 a year per person. But notice what happens as our income rises. So before it doubles from $180,000 to, say, $360,000, our annual cost of Medicare more than triples to nearly $13,000 a year. Knowing where these breakpoints are can save you a bundle in Medicare insurance premiums. But the unfortunate reality is, once we enroll in Medicare, we oftentimes have limited flexibility within our financial planning. For instance, by the time we're 70 years old, we have to claim our Social Security checks. By the time we're 72 years old, we have to start drawing from our largest retirement accounts in many cases, being our 401ks and IRAs. Oftentimes, it's too late to do much about managing one's income when we no longer have as much flexibility to control how much income has to show up on our tax returns. That's why it's important to try and plan proactively years in advance so that you have more flexibility to minimize how much income shows up on your tax return and ultimately minimize your Medicare costs each year. So as we've talked about in prior videos, the strategies that most significantly impact your long-term Medicare costs are strategies in which you deliberately pay taxes earlier so that you don't have to pay taxes to such a large degree later and ultimately increase your income. And those strategies would be significant Roth conversions, specifically before you reach age 72 and have to take distributions from your IRAs, and also managing your portfolio so that less income is distributed from accounts each and every year through asset location or strategic gain harvesting.
Thank you, Nate. That was really great information. Hopefully, you can see that with some thoughtful planning before and in retirement around healthcare, it can be much more affordable than at first glance.